Beer is one of the most common and consistently risky dietary triggers for people with gout or chronically elevated uric acid, and that risk goes well beyond a simple "alcohol is bad" slogan. Mechanistically, beer combines several urate-promoting forces. It delivers ethanol, which the liver metabolizes in ways that increase lactic acid and shift renal handling of urate so less is excreted. It accelerates purine breakdown and increases nucleotide turnover, producing more uric acid, and many beers carry residual brewer's yeast and other purine-rich components that add to the total purine load. Put simply, beer both increases uric acid production and reduces the body's ability to get rid of it, a double hit that makes beer a uniquely potent trigger compared with many other alcoholic drinks. Epidemiological studies repeatedly find beer to be the single strongest alcoholic risk factor for gout onset and flares, and this is borne out clinically. Gout attacks often follow episodes of beer consumption or binge drinking more frequently than other alcohol types. The practical harms extend beyond immediate gout flares. Regular beer consumption contributes to weight gain, insulin resistance, fatty liver, and elevated triglycerides, all metabolic conditions that worsen uric acid handling and raise long-term risk of recurrent attacks and chronic joint damage. Beer's high calorie content and the typical social patterns around beer, larger volumes, frequent drinking sessions, drinking with salty or high purine bar foods, make it especially likely to undermine weight loss efforts or dietary strategies intended to lower urate. During an acute gout flare, drinking beer is especially unwise. It can prolong the attack, make pain control harder, and interfere with the effectiveness of some interventions. Even when not in a full flare, regular beer intake keeps baseline urate higher, increasing the chance of future attacks and the need for long-term medication. Not all alcoholic beverages carry identical risk, and that nuance matters, but it does not excuse beer. Wine, particularly moderate amounts of red wine, appears to have a much smaller association with gout risk in most large studies. Spirits show an intermediate relationship. That said, smaller association is not safe for everyone. Individual susceptibility varies a lot. Some people will experience flares after a single beer, others tolerate occasional small amounts. Genetics, kidney function, body weight, hydration, and whether you combine alcohol with high purine foods all change the odds. Binge drinking or consuming several beers in one sitting sharply increases the probability of an acute attack compared with one drink spread out. If you have gout or high uric acid, the most protective approach is to avoid beer entirely. If abstaining isn't acceptable for social reasons, harm reduction matters. Greatly reduce frequency, limit quantity to the smallest possible amount. Avoid beer when you've recently eaten other high-purine foods, never drink during an acute flare, and ensure excellent hydration before, during, and after drinking. Be extremely cautious about non-alcoholic beers. Some contain yeast extracts and salts and may still provoke symptoms in sensitive individuals, so don't assume they're harmless without testing personal tolerance. Weight loss. Reducing sugary foods and drinks and improving overall metabolic health will also lower your baseline urate and reduce how much an occasional lapse affects you, but these steps are complements, not substitutes, for cutting beer intake. There are also medication-related considerations. Alcohol can complicate management for people on certain drugs. It may interact with how well urate-lowering therapy works or increase side effect burden for other medications used concurrently. If you're using allopurinol, febuxostat, probenecid, or any other prescription to control uric acid, discuss alcohol policy openly with your prescribing clinician. They can give guidance tailored to your kidney function, comorbidities, and the exact medication regimen. Finally, don't rely on internet's safe amount rules. The relationship between beer and gout is dose-dependent but highly individual, and what's safe for one person may trigger a severe attack in another. In short, beer is more than a minor risk. It's often the single most important modifiable factor driving gout attacks. The safest course for people with gout or high uric acid is to avoid beer. If that's not possible, treat beer with extreme caution, minimize amount and frequency, avoid it during flares, prioritize hydration and metabolic health, and consult your doctor about how alcohol fits into your personalized treatment plan.